Improving clinical outcomes for women with overactive bladder and urinary retention symptoms, a comparison of motor response voltages 1 through 9 during stage 1 sacral neuromodulation. Hello, I'm Dr. Serge Marinkovic. Stage 1 sacral neuromodulation is a sophisticated electromyographic or EMG study. You can see that on this external pulse generator that you can manipulate the power from 1 to 9 volts, and on the newer digital monitors, in tenths of a volt. Typically, your pharmaceutical rep would place this at 6 or more volts to get as much stimulation as possible and promptly elicit your bellows and plantar flexion, hopefully shortening your case and time to lead placement. But EMG theory implies the need to elicit a motor response at the lowest possible energy level. In our paper, Table 2, we have less than 3 volts in Group A and more than 4 volts in Group B. Table 2 shows for the common voiding parameters such as frequency, urgency, UDI-6, 2Q7, patient global impression of improvement, that the results demonstrate an 11 through 39% improvement by simply finding the S3 nerve at 3 or less volts. Figure 2 compares our 3 volt data to other major studies at the traditional 6 volts or more, and you see our study's improvement of up to 70%, marked in blue, with typical voiding parameters. There is one proviso for future surgeons with my method. First, in Figure 1b, once you go to 3 or less volts, voiding parameters do not clinically improve or statistically improve compared to themselves. However, going below 3 to 2 or 1 volts comes at the expense of increased patient pain with self or physician reprogramming, noted on the last line on the right. As little as 0.1 or 0.2 volts and up to 32% of 1 volt patients may elicit sharp perirectal/bladder pain and big toe movement. That's why we recommend finding the S3 nerve at 3 volts, where all the great clinically significant improvement occurs, but with less than a 1% opportunity for pelvic pain with reprogramming. Thank you.